Degenerative conditions of the spine are due to arthritis in the spine. It happens naturally to everyone, but not everyone gets symptoms. There's basically two ages where it can happen, and it depends also on the location of the problem. It first starts in the early 20s in the lower back, when you can get disc herniations or back pain as the discs naturally wear out and degenerate. It then can occur in the lower back in the 50s and 60s when you develop further arthritis in the facet joints, which are paired joints in the back of the spine. And then you can begin to get back pain again, buttock pain, or weakness or numbness in your legs. It can have a genetic component. There are tendencies in different families to have back problems, probably related to conditions that we don't understand, but then also their anatomy. So there's a spectrum of space for the nerves in the back, and some people have more space than others. There's a spectrum of symptoms, and it can range from a backache that is short-lasting, maybe a few days to a week or so, to leg symptoms such as sciatica, pain, numbness, tingling, or weakness down your legs or arms. There are some conditions in the back where if left untreated, the pain will worsen over time. Those conditions can be treated with medical management, including exercise, medications, sometimes shots, and in extreme cases, surgery. Degenerative spine conditions are diagnosed first with taking a careful history, talking to the patient, and doing a physical examination to determine if there are any physical signs of the condition that you have to be aware of. It can spread to other parts of the spine as they develop arthritis. Fortunately, most of the time, the symptoms are short-lived, get better either on their own or with physical therapy and over-the-counter anti-inflammatory medications or other types of pain medications. Occasionally, it requires more advanced treatment. Disc degeneration is a normal part of the human condition. When it puts pressure on nerves and the nerves develop symptoms such as numbness or tingling or weakness or pain, it can cause permanent symptoms. Nonsurgical treatments that are used to treat degenerative spine include physical therapy, which is the mainstay of treatment, and this usually involves a home exercise program. Anti-inflammatory medications such as ibuprofen or Motrin or Aleve are also used, and occasionally prescription medications will be needed too. Surgical procedures really depend upon the type of problem that you're having. If you're having leg pain or arm pain and it's due to pressure on a nerve, procedures can be performed to take the pressure off that nerve and relieve the symptoms. In some instances, a fusion is necessary to treat either instability, too much motion in the back that either exists and is causing the symptoms or is created in the course of the operation, or in rare occasions to treat the back pain or neck pain itself. Recovery is a process of getting better. First, after surgery, there is pain associated with the operation itself. That is treated with pain medications, but then also goes pretty rapidly away on its own. Then there's physical therapy to get your mobility back and your strength back in your body. And then there's a general recovery process after that. We're in the early phases of looking at ways to prevent or reverse arthritic changes in joints and in the back. This is being done in an experimental level in our lab, and some clinical trials are also underway.